Hello, and welcome to Karen's Medical Corner. I'm Karen O'Day. I'm a certified family nurse practitioner and a certified nurse midwife with private practice in Santa Fe, New Mexico. The name of my clinic is EverCare Family Practice, and I specialize in family health care, aesthetics, and on hormone replacement therapy. I appreciate you joining me for the second podcast in a women's health care series. The first podcast was done last week and discussed urinary incontinence, urinary frequency, and urinary urgency, and the benefits of V-Tone electronic muscle stimulator, as well as an introduction to FormaV and Morpheus8V. So today I wanted to kind of build on that platform with discussing FormaV and Morpheus8V and how it can help with problems that women tend to experience perimenopausal and postmenopausal regarding vaginal dryness, vaginal pain, pain with intercourse, and vaginal laxity. A lot of these topics that we discuss, women are hesitant to talk about for a number of reasons. Sometimes they feel like they'll be judged, sometimes they're embarrassed, but oftentimes it's something that women don't volunteer information on, so it's very important for healthcare providers to ask those questions. But it's also important to realize for patients that this is super common. I mean, many women experience these symptoms. They've had studies that have been done that have shown that up to 60% of women postmenopausal have multiple complaints regarding this topic. But a lot of times they go untreated and women suffer, decreases their quality of life as well as their self-esteem, and makes them not want to have the life that they were hoping to have as they grow older. So I always encourage patients that if you think you're alone with your symptoms, you're not alone in your symptoms. Thousands and thousands and millions of women are experiencing the same symptoms you are, but nobody's talking about it. So bringing it to the forefront is something that's very important to me. And it took me a while to figure out how I was going to do this podcast because I was told recently that you can't say the V word on some of the social media platforms. And I'm hoping that that's actually not the case, because this podcast isn't meant to be insulting. It's not meant to cause offense. It's not meant to be vulgar. These are actual medical terms that actually need to be used in order to address these women's health care issues. So I'm hoping that these platforms will recognize that and realize that this podcast is an informational podcast for patients and the generalized public, for people who are having symptoms or who just desire more information regarding these health care issues. So the first thing I wanted to talk about was going to be treatment options. We'll get into other things regarding patient candidacy and that type of thing further into the podcast. But talking about treatment options first is important to me. So there's a lot of treatment options for vaginal dryness, vaginal atrophy, pain with intercourse. A lot of them, most of them include medications. Some of them include different types of inserts or devices. Hormone replacement therapy is one of the mainstay of treatments for these symptoms. And hormone replacement therapy is actually an excellent route to choose to treat these symptoms. However, not all women are candidates for hormone replacement therapy, and not all women desire to have hormone replacement therapy. Everybody has their own idea of how they want their life to proceed, and a lot of women don't want to have anything that they're putting into their system on a daily basis. So this treatment option is fairly new. It's been out for a few years, but it works really well. The FormaV is a procedure that is non-invasive. It is done using this device right here, which is the FormaV. I showed it last week. It's a bipolar radio frequency device that's gently inserted into the vagina by the practitioner, and it's used in a circular motion to deliver radio frequency energy into the delicate tissues of the vagina and the external perineum. It is indicated for both internal and external rejuvenation and revitalization. And it can also be performed to maintain the benefits, and it is always recommended that women have follow-up treatments after they finish their initial series to help maintain the results that they have achieved. It's a gentle treatment. It's completely painless. You can hand pick the energy level that the woman is being delivered, and the treatment in the vagina can be anywhere from 10 to 20 minutes. The heat that's delivered triggers a thermal remodeling of those tissues and helps to rebuild collagen, stimulates collagen production. And so the tissue begins to tighten and strengthen over time. Now with this treatment, it's ideal for women who are having vaginal dryness, vaginal laxity, decrease in sensation in the perineal and vaginal area, as well as women who are experiencing discomfort with intercourse. And it also, as talked about last week, is indicated for urinary incontinence. And it works very well to also tighten and tone the external labia minora, labia majora. It helps as well with the clitoral hood and the mons pubis. And those areas are, again, areas that women don't routinely talk about because for a number of reasons, but a lot of times they're embarrassed and they don't know what type of response they're going to receive from their provider. So I encourage you, if you're having any of these issues, to please contact your healthcare provider regarding treatment options. So the FormaV is a series of 3 treatments. It's 1 treatment a month for 3 months. After that treatment, after those 3 treatments, we usually have women come back at either 9 to 12 months so that they can have another treatment in order to help maintain the improvement that they've had with the initial series. There's no downtime to this procedure, so you can go back to your regular activity right after the procedure is done. You can go to the gym, you can go back to work, you can enjoy sexual intimacy without any problems. And the tissue will start to tighten significantly after the 3rd treatment. And it'll continue to tighten, and people will continue noticing a difference for months after the 3rd treatment because results are usually progressive. And again, we don't know exactly what the benefit will be to each woman because everybody's different, but it's a very good treatment. And like I said, for my patients, I haven't had anybody who's told me that they haven't had significant improvement. So with that radiofrequency heat and in stimulating blood flow to the area, we're having, again, that collagen promotion and regeneration and restructuring of the tissue. Now for women, a lot of women, that treatment is adequate and they don't need to have any other treatments. But some women have more significant symptoms for whatever reason. Can be from genetics, can be from different events that have happened in their life. And they may need to have a treatment that is a little bit more extensive, and that would be with the Morpheus8V. Now the Morpheus8V is a radio frequency device that also delivers microneedling at the same time. So this procedure is a little bit more involved. It's a little bit more extensive. It's very effective. It provides remodeling of soft tissue, and it's nice because it does combine that radio frequency and microneedling to help achieve optimal results with minimal risks, minimal downtime. Now, the radiofrequency microneedling can go up to a level of 3 millimeters. It's usually done, again, in a circular fashion so that the microneedling is done in all aspects of the vaginal walls and then on the perineal area as well. The microneedles are made with they're covered with a gold coating, which is an excellent conductor of heat to help with that radio frequency. It's customized for every individual patient, and again, the energy level is controlled by the provider, but the patient also gives feedback. Now, in order to do this procedure, the patient has to come to the office about an hour to an hour and a half prior to the treatment to get numbing medication, which is usually done with what's called BLT cream, benzocaine, lidocaine, and tetracaine. And there are other formulations too, depending on the provider's office and different strengths that are used. But once the area is numbed up, then the microneedling can be performed, and it is not an uncomfortable procedure. There are differeces in downtime with the Morpheus V than with the FormaV because of the microneedling causing that micro injury to the tissue. So we do have women not get into a tub of water, whether it's a bathtub, a hot tub, or a swimming pool, for approximately 3 days to avoid vaginal intercourse for approximately 3 days so that that tissue can heal. A lot of times women will tell me after the procedure that they feel like they have like a little sunburn down there. They feel a little tightness down there. You can put on, I usually put on a little bit of colloidal silver on the external genitalia, followed by a little bit of Aquaphor, and I send my patients home with Aquaphor to put on the outer area for the next few days until healing occurs. Nothing should be put in the vagina, however. The vagina is self-healing and it should not need any type of aftercare treatment. Just, watching, what you're doing as far as minimizing risk of infection. So again, those are 3 treatments that are done with the Morpheus8V, again a month apart. And many times women will come back at 9 to 12 months again for a retreatment because we have to keep up the results. Otherwise, things are going to go back to the way they were. Now, these devices are disposable. So once they're used, the Morpheus8V is put into a sharps container. It is not reused on any patients. It is completely disposable. And we use a new one every time a female comes in. Now, as far as candidates for this procedure would be adult women who are having any of the symptoms that we just discussed. Sometimes women who are not perimenopausal or menopausal will come in after their postpartum period because they're having vaginal laxity, they're having decrease in sensation, or they're having increase in pain, and they desire treatment. And many times, a lot of the women are perimenopausal, they're going through menopause, or they're postmenopausal. So prior to having any of these procedures done, a full, thorough health exam needs to be conducted. This can either be conducted at the provider's office who's going to do the treatment, or they can get a referral from their healthcare provider as far as primary care or women's healthcare provider if that provider does not offer the treatments in office. When someone comes into our office, however, we always like to, especially if we're going to do Morpheus8V, do a thorough exam because there are other reasons women can have symptoms. There can be anatomical changes that can be giving women symptoms that need to be addressed. There can be infection. There can be other disorders that are causing symptoms in that area, and they need to be treated first. And if symptoms still don't resolve, then talk about doing these treatments. But a thorough physical exam and a very thorough interview needs to be done as well. An inspection of the area to be treated also needs to be performed. Now, with these treatments, there are also patient contraindications. So one reason that patients may not be a candidate for having any type of radiofrequency done would be anyone who has a pacemaker. If you have metal in the area that's being treated, that would need to be removed. Anyone who has active cancer, anyone who's pregnant or breastfeeding, we do not do these treatments on. If you have any type of active infection, those all need to be treated. And then we also look at underlying conditions such as autoimmune disorders, diabetes, to determine whether or not patients are candidates. And that's not all inclusive of what we look at when we are determining whether someone is a candidate. It's just a small idea of what we would be looking at. So when you go in for treatment, you need to make sure that you have your complete list of medications that you take, your complete list of health problems or related issues, whether or not you're pregnant, whether or not you're breastfeeding, And again, people who have significant blood clotting problems, we don't do the microneedling on. If they have anything like thrombocytopenia, significant anemia, if they are having any type of immunodeficiency, we would not want to do any type of microneedling to those patients. And again, this is just a small list of contraindications. You can talk to your healthcare professional prior to having any treatments done to see if you are a candidate. Any active infection that someone has would need to be treated and then reassessed to make sure it is cleared prior to treatment beginning. So to reiterate, this treatment is an excellent treatment if the patient is a candidate. If you are interested in having treatments done, you can look up V-Tone, FormaV, Morpheus8V online to find a provider near you. We do provide those treatments in Santa Fe, and our number is 505-780-8301. You can get more information on these treatments on our website at www.evercarefamilypractice.com. And if you have any questions regarding these treatments or would like to make an appointment, you can call the office. You can also email me at evercarefamilypractice@gmail.com. I look forward to any questions, any comments that you have. Again, this is just a basic overview giving you information on what's available regarding treatment options. We're going to be doing our third podcast in our Women's Health series on hormone replacement therapy, which is also indicated for men, but we'll put that in a different podcast to kind of separate out the two genders a little bit to be more specific for each. I look forward to hearing from you, and I want to thank everybody who has joined us today and everybody for listening. Thank you, Kathy V, as well as Brad F, and all of our California listeners, Amanda, as well as Jim and Wes. And I appreciate all of the Facebook listeners as well and Instagram followers. And I wish everyone a healthy, happy life in pursuing what makes you happy and making choices involving what you do with your own health care. Thank you so much for joining us.